was a very broad question. So there are questions about medications in acute treatment for PD besides apomorphine. So what I believe he's asking about is acute treatment, meaning rescue treatment if someone is completely off. So there are many things you can do. If there is, so acute treatment, I'm guessing that somebody's completely off in Parkinson, either unpredictable off or missed his medication or something like that, and you need him to turn on quickly. So those we call it as rescue treatment. One thing you can do is to crush the levodopa pill and have him take that, and that will make it dissolve faster. You can mix it with acidic solution. It won't dissolve in water, but if you take Coke or Pepsi or whatever your local drink is, acidic drink, or orange juice, and you take that crushed pill in 2 sips of juice or Coke and mix it, it will dissolve quickly. And then they can drink that, and that can kick in very fast. If you have access to other medication, then Parcopa is a disintegrated form of carbidopa levodopa. It's PARCOPA, Parcopa, and it's sublingual. So you take the tablet, you put it under your tongue, and it melts. And some of it absorbs in the mouth, but most of it is swallowed and absorbed in the gut. So it's a fancy way of doing the same thing I mentioned earlier. Crush the tablet, mix it in Coke, and take it. So that's kind of what that Parcopa is doing. And that kicks in 20 minutes, 15, 20 minutes, 30 minutes, depending on the stomach. Now, if you need to bypass the stomach, then there are 2 new treatments available and one old one. So the old treatment was apomorphine subcutaneous injection. So those are probably available outside of America too, in Europe, maybe in Africa. And it's basically a pre-filled syringe that has some amount of apomorphine. You figure out how much you want to give, and I think you can dial it on the injector, and then you inject it under the skin, on your belly, shoulder, chest, and it kicks in 10 minutes. There is now a sublingual form of apomorphine that actually absorbs in mouth. Unlike Parcopa mostly don't absorb in mouth. It melts and just is swallowed, and it has to go to the small intestine. But the sublingual apomorphine, you put it under your tongue. It's like a dissolving mint strip. So you put it under your tongue, it melts there and absorbs there and bypasses the liver. The reason apomorphine cannot be swallowed is because if you swallow it and it is absorbed in your stomach, then it goes into the liver and liver destroys it. It metabolizes it. So none of it makes it to the brain. But when it melts in the tongue, the blood supply is just under the tongue. There is a small patch of blood vessel there, which drains directly into the heart and bypasses the liver and goes into the heart and is pumped into the brain. And that apomorphine makes it in the brain and is absorbed and kicks it in 5 to 10 minutes. And it's called Kenmobi, Kynmobi, Kenmobi. It's a very new drug. The other one that is available that bypasses the liver is an inhaled levodopa. It's called Inbrija, INBRIJA. It's basically a very, very fine powder of levodopa. So it's not a gas. It's still solid, but it's just you keep basically crushing levodopa to a very, very, very fine powder. And then what they did was that the powder particle, even when it's very small, is still round, so it does not lift up with air. So what they did was that they had this lattice, almost like snowflake. So they have these snowflake-like particles, which are very thin and broad, and they put these micro powder of levodopa onto those snowflake crystals. But now it's almost like a magic carpet. I just saw Aladdin play yesterday. My daughter is doing in her 8th grade in school. So it's almost like these magic carpets with these embedded particles of levodopa on it, and they are in a capsule. So you put capsule in this tube and close it, and the tube punctures the capsule and make 2 holes, one on the top, one on the bottom. And then you take a deep breath and you suck in air. And as the air runs through the capsule, it lifts up those lattice work with levodopa particles on it, lifts it up, floats it with the air that you're breathing. goes through your mouth. Some of it deposits in your mouth. Actually, depending on how deep of a breath you take, nearly half of it may be just deposited in your mouth and is lost. But the rest of the half goes with the air into your lung and sticks to the alveoli inside your lung and absorbs there. So they have the capacity to absorb the levodopa particles, very, very fine particle, microparticle. And they get absorbed in your lung. And now from your lung, they go straight to the brain and bypass all the heart and everything and liver. And that also kicks in 5 minutes. So inhaled levodopa, Inbrija, sublingual epomorphine, Kenmobi, subcutaneous epomorphine, Epoken, Parcopa, orally disintegrating tablet, or crushed tablet dissolved in acidic juices like cranberry juice, citrus juice, orange juice, or Coke, and taking that. These are all acute treatments or rescue treatments for acute akinesia, bradykinesia, and Parkinson. All right. So next question Hafiz has is other acute treatments in movement disorders. That's a very, very broad questions. That's just too much for me to even recall. Easier for me to do in a specific question. Acute treatment could be for freezing. Acute treatment could be for chorea, dystonia, acute dystonic reactions. It could be for NMS, neuroleptic malignant syndrome, and so on and so forth. There's a very good lecture by Dr. Torres on acute on movement disorder emergencies that should be in that Echo 360